Great. Thank you, Pat. And good morning, everyone. And welcome to the Minnesota Chapter Virtual Conference, COVID Innovations and Impacts. My name is Janine Clancy. I'm the Metropolitan Council Environmental Services Assistant General Manager for Wastewater Planning and Capital Project Delivery. Next slide, please. And Pat, why don't we go on to the next one as well? Before we get started here today, I wanted to thank our sponsors. As the Minnesota Chapter's APWA delegate, I know how critical the financial support of our sponsors is to the success of our organization. And you can see the sponsors on the slide on your monitor. But in addition to their financial support, these sponsors are all known for investing their time and energy into ensuring the success of this chapter. And that's one of the things that makes the APWA Minnesota chapter so special. We have been through good times, and in challenging times like these, we tend to do these all together. So on behalf of the APWA Minnesota Chapter Executive Committee, thank you, sponsors, for all that you do. Next slide, please. And we have 5 panelists today. First, you will hear from 2 members of the Metropolitan Council's Incident Command Team. As you all know, the Metropolitan Council has 4 operating divisions, and today we will hear from Metro Transit and the Metropolitan Council Environmental Services. So first, Brian Funk, Deputy Chief Operating Officer with Metro Transit, will speak. Brian will be followed by Craig Edlin, Director of Asset Management and Acting Operations Assistant General Manager with MCES. Brian and Craig will discuss operational challenges and strategies implemented to ensure continuity of service during COVID. The conversation will then transition to project and construction activities during COVID. Don Elwood, Director of Transportation and Engineering for the City of Minneapolis, will describe innovations introduced during COVID on the Hennepin Avenue reconstruction project in downtown Minneapolis. Working with partners across the APWA industry, the project team used existing tools and new ways to collaborate and communicate a complex project. Many of these changes will become standard practice on future projects. And then finally, Dan Pfeiffer, Director of Public Engagement at WSB, and Dan McNeil, Public Engagement Coordinator at SRF, will wrap up this session by discussing successful public engagement opportunities and innovations that they have had with clients during the pandemic. Throughout this session, there will be opportunities for the panelists to respond to questions. So, like we usually do at Earl Brown, we ask you to hold your questions until the end, but not today. Please enter whatever questions that you have in the chat, and I will direct those questions to the panelists at our planned session breaks. So on to the session. Brian, the mic is yours.
All right. Thank you, Janine, for this warm welcome and the opportunity to share just a little bit about Metro Transit's experience going back to this spring and bringing us up to present day and how we were able to effectively respond and manage and maintain our critical services throughout the start of this pandemic and how we're forecasting to move forward. And thank you to APWA as well for having me here as a speaker. I had the good fortune to speak to a group a couple of years ago following our success during the Super Bowl that we hosted in 2018, which feels like a long time ago, although the weather looks the same these days. Again, I'm the Deputy Chief Operating Officer for the bus system at Metro Transit. However, as you can see, we of course are a multimodal organization. And during the pandemic, I've assumed the role of Operations Chief. And so fitting that into our council incident command structure, it really translates to I'm the clearinghouse for all of the plans that we need to put into place, going back and forth, and then communicating with our incident commander and the executive policy group and our board on the status of the situation and how we are effectively both delivering our services, but then also keeping our employees and customers safe. Next slide. As we all know, the pandemic started sort of quietly back in January, and it started to trickle through. And we started to dust off some plans and order some extra PPE in January. Attended a Department of Health meeting first week of March before a case even emerged here in Minnesota. But we put our plan into place and started to have internal briefings. On March 14th is when we started one of our new quarterly service changes. So we just had a brand new schedule released for our operators to drive and our customers to expect. And within 3 days, we had to shut down our overnight bus and rail service because we were not able to disinfect all of our equipment and start that process per the initial guidance without having that ability to catch our breaths. The next day, it was announced that schools were closing. A week later, we were able to implement well-crafted service changes to focus on our core service, where we knew that the most people who depended on our service were going to continue to ride. And that was what we had all referred to as those essential trips during that time. We also implemented some rear door boarding so that our employees, with all of the uncertainty, did not have face-to-face contact with customers until we got some more of the protections in place. By March 28th, our state initial stay-at-home order started, and we continued to make adjustments through the month of April as we learned more and tried to put into practice the guidance being provided from both CDC, Minnesota Department of Public Health, as well as APTA, which is our industry, public transportation industry group, who collaborated across the country really to figure out what were going to be the best practices, absent having everything ready to go for a novel coronavirus. Next slide. We made those changes and immediately draw down, and you can see in the chart on the right that our ridership reflected the service changes that we made. In particular, the red dots on the bottom show our express bus ridership. That primarily is catered to the 9 to 5 commuters in the downtown core areas, and it all but evaporated. We had no demand, therefore we put out nearly no service. In fact, for this winter, we are putting in place lockdown plans on some of our park and rides to save just on snow removal expenses and whatnot, because it just has not returned without those offices reopening at all. The middle lines on the bottom show our demand by weekday for our light rail system. That's bounced around a little bit, but it's not on a gradual increase. We really have continued to see that be pretty flat at about 70% below pre-pandemic demand. So we're talking about 30% of the customers out riding on that rail system. A large part of that, of course, is work commuter trips, but also the University of Minnesota and special events, have an impact on our ridership and demand, and they just have evaporated. The one that's served us the best is the blue dots in the middle, and so that's our local bus service. You can see we were on a gradual decline absent the first several days of June when we paused all service during the civil unrest following the murder of George Floyd. But we were continuing to see a little bit of an upward trajectory, and that's right before we started our fare collection again. So the drop on August 1st corresponds to that fare collection resumption. We weren't collecting fares for several months because of both the money handling and the front door boarding precautions. But once we were able to design, manufacture, and install all of our own COVID barriers for the bus operators, we did resume that. Certainly, like all organizations and businesses, our bottom line has been hurting, pretty dramatically, and so returning some sort of ridership revenue for the services we're delivering was important from both a policy and a practical level. For the months of the service changes in June, August, and December, we have 2 scenarios for each of those so that we're able to adjust to both workforce availability as well as demand. And so our demand has stayed, as this chart shows, level. So we're currently operating at an 80% of pre-pandemic service level. most of that focused on our urban local routes, of course, based on this demand. We do have that backup plan. So like we're experiencing this surge in cases across the state right now, we have a planned drop back in case we have a large number of our employees either infected or needing to isolate because of other infections in the community and their households. Next slide. So in addition, we've made these operational changes, but you'll hear from Craig as well, our employee safety is first and foremost. And so since mid-May, we've offered free COVID testing through a partnership with health partners for both one of our on-site work clinics as well as the drive-through. We've had a lot of interest in that, but we're now continuing to take the next step to try to be able to provide more opportunity for even at-home testing. We have required face coverings on board our vehicles since mid-May. We are not slowing down that effort. In fact, yesterday we renewed our focus on that with additional encouragement, education, and enforcement efforts, both from our civilian workforce as well as our transit police. We're trying to hold up executive order requirements as well as meet CDC guidance. And just in the last couple of days, the CDC finally issued guidance that that shows that even fabric face coverings do provide a benefit for the person wearing the mask from exposure coming from others. And so we're going to leverage that information to continue to encourage that workplace and onboard requirement. We have communicated to our customers, and we're going to continue to renew the effort. You'll see here our campaign is ready to ride with a question mark, and that's intentional because as much as we're doing, we do rely on our customers to also be responsible to not travel when sick, to cover their cough, to wear a mask. And so this is an effort for us to have it be a question as to whether or not they are actually ready to ride and using our service when they need to. It's not time for joyriding as much as we like to have people out in the system. And so that's going to be our renewed focus, at least going into next year. And finally, I know that this is a public works group, and so I wanted to just address that Metro Transit at the council, we're part of some very large construction projects, as no doubt know. Southwest Light Rail continues to be constructed. We thankfully got our full funding grant agreement earlier in the year, and so that project is going on and extending our Green Line system out to Eden Prairie. They've been working really hard with all of the vendors and contractors to ensure that they can continue to maintain a safe construction site from all facets, including for COVID preparedness plans. The Orange Line 35W MnDOT BRT construction project is ongoing. This overhead drone footage is out at Knox Avenue in Bloomington, showing a tunnel that's currently under construction right underneath 35W near 35, or right under 494, excuse me, near 35W. And finally, we're building a new about 220 bus facility next to our Haywood Garage in the North Loop of Minneapolis. And so that's a very large construction site for us. We're really excited. It's been more than 10 years in the making. And again, we're taking the proper precautions, but this is about investing in our future, and we have no intention to slow down despite this temporary setback. So with that, I think that wraps up my portion today.
And good morning, everyone. And also, like Brian said, thank you very much to APWA for having us in and giving a little presentation really about kind of how we've been approaching our pandemic response. And similar to Brian, I am also a operations chief in our incident command, and I do that for environmental services. So many of those plans, when we go to put those in play, do come through me, along with the director of asset management and the assistant general manager of operations. It keeps them very busy and out of trouble. So it's been a very busy, what is we now in 8 months. So today I'm just going to give you a little bit about a high level view of some of the things that we're doing on our pandemic response and how we went about looking at doing our pandemic response. Really, in ES, we took the viewpoint of having three very distinct goals that we were trying to meet with our response. You know, prevent the spread of COVID within the workplace, reducing any risk that we may have to disruption of our essential services, and definitely supporting the employee well-being while this is all going on. Next slide, please. So preventing the spread of COVID in our workplace. This really began similar to what Brian had said before, as we were seeing, like many organizations, as we were watching what was going on across the world and in the US, we started to review our continuation of operations plans, looking at how are we going to make sure that we have the things in place. And that included looking at our incident command structure, revising and updating as needed, and also reviewing our stock of cleaning supplies and other PPE, making sure that we had what we needed, knowing that if there was spread, we were going to see some shortages. So we wanted to make sure we had what we needed. And one of the things that we also did was when the executive order hit us on March 13th with the peacetime emergency declaration, the Metropolitan Council, we activated our COOP plans and stood up our incident command teams that weekend. So starting March 16th was really a transition for us to take all of our employees that were categorized as essential telework and have them starting to transition to do telework. So we categorize our employees in two very distinct spots: essential on-site, so those who could not or did not have the opportunity to do teleworking, and those who could telework and do maximize their time doing telework. So when that stay-at-home order hit on March 27th, we were ready. We had the equipment in place, the guidance in place, and everybody had transitioned by that time then to on-site or to remote teleworking. So even as we were standing up our ICS and we were understanding that on-site and at our facilities, we really started looking at making sure everybody understood to follow those CDC guidelines and MDH guidelines around social distancing, around face coverings if we couldn't do social distancing. And when I say social distancing for us was not just as you're standing there talking with somebody, but when you're working side by side, staying away from each other. If you couldn't stay away from each other, you had to wear the face covering. Putting in guidance for common areas of the plants, process areas, our shop areas, all of our control rooms, lunch and break rooms, locker rooms. It's amazing when you start stopping and thinking about all those places where people congregate. There's a lot of those when you get into a big facility. And then vehicles. And I think vehicles was a tough one because, as you know, we do have our interceptor workers and they're out in the field looking at our lift stations, working on our metering sites. And for them, that was a big change to go to one person in a vehicle. So now we went from having one vehicle going out to multiple vehicles going out to a site to do work because we had that social distancing of one person per vehicle. We also put in plans and guidance on cleanliness and hygiene and coming up with schedules for who's doing the cleaning, what kind of cleaning is being done. And one of the big ones that we did put in place and did this along with Metro Transit as well, we were all kind of working together trying to do a common approach to these things, was pre-entry health screening. And that was really looking at anybody who wanted access to any of our facilities, employees, visitors, vendors, contractors, anybody had to go through the pre-entry health screening. That was answering those basic Minnesota Department of Health questions. And then it also included a body temperature check. Now, initially we started using the infrared handheld thermometers, which were also very hard to come by at the time we were starting all this. But with the handheld thermometers, you end up getting someone has to get close contact with others. And as we were looking at that, as always, you do continuous improvement as we're going through these things. So we looked at that and said, there's got to be a better way of doing this to get that close contact down. And we did a new move to infrared temperature kiosks, which then people can use as they come in, they're answering the questions, they take their temperature. If everything is okay, they have access to the plant. Next slide, please. So reducing the risk of disruption to our essential services. So as we were reviewing those continuity of operations plans, we did see that there was a need to update those COOPs to address the pandemic. And so therefore we started coming up for all of our facilities and our major business units, a pandemic supplement plan. And some of the things that are included in that pandemic supplement, staffing plans. Very, very critical. Going through staffing plan of what are all the critical tasks being done within that facility or by that business unit, identifying those, prioritizing those so we know what we could do if we didn't have people, primary and alternate leads to working these plans, and then what support from the other internal and external, so contracted services or internal maintenance services, our engineering department, construction process. So everything is kind of put down in that plan so we know who we needed to be able to continue meeting our levels of service, including chemical deliveries. So if we had critical chemicals, making sure that we have delivery plans so that we could be able to get those chemicals on time. Those also included the cleaning and housekeeping schedules within each facility and communications around how to, if we have ill employees, how do we do close contacts and positive cases. So with the close contact tracing, as we get someone who is identified, we do have a procedure and a process around from the time someone calls in through the contact tracing, moving right into a rapid response disinfection contractor, and then also making sure that all close contacts do get tested. And as Brian said, they in transit has a contract right now for free testing with, with Health Partners, and we are moving towards having those test kits available actually on site so that we could get more home testing and rapid testing so that we have those test results back quickly and able to actually manage what's going on and making sure we have the right people. And next slide. And also reducing the risk of disruption to our essential services because, as Brian said, we have a lot of construction projects that are going on and they are essential to the business. We have to continually update and upgrade our infrastructure and have new infrastructure going in. So some of the things that were being done on our construction side, utilizing software to do the project management, watch the flow, do payments. So we've been using our online e-builder and Adobe Sign to get those construction documents and pay claims done in a contactless way. That's much more efficient. General contractors have pandemic safety plans and response plans for each of those sites as per MIN-OSHA. We're holding virtual pre-bid meetings, and those include 3D imaging as well. Doing video training for our operations and our maintenance staff on projects as they are being completed during commissioning, and also using virtual community meetings for doing customer outreach. And we also have really maintained our commitment to public engagement throughout the pandemic. And our staff and consultants have developed very creative ways to connect with residents, including those virtual outreach meetings, pop-up community meetings in the park, making sure everyone is socially distanced, and then even using yard signs instead of the door hangers as we used to. So instead of having, walking up to someone's house, we're doing yard signs and getting the word out that way. And next slide. And as far as support employee well-being, this was very, very important for us as we have employees that are both on-site and not on teleworking. And truly, the pandemic has been very hard for both of these sets of employees, because those who are on site every day, they're coming in, they're having to do their work. They do not have the opportunity to do teleworking. Those who are working remotely and doing teleworking, there's a certain amount of isolation, and I can tell by the video that many people are doing teleworking right now who are on this call, and it does rather hard. You're isolated at work, you're not around people, and that can take a toll as well. So knowing this, we have taken care to make sure that employees are doing well, making sure we're reaching out to both of these groups and having one-on-one discussions where we're doing virtual employee check-ins, which can be a manager to an employee. It can be a peer-to-peer. It can be a manager to not their employee. And we're making sure to have those one-on-ones periodically throughout the week, and you're making sure to be using video, because it's very important for people to have a connection in that video and seeing that person you're talking to. Very important for having that connection, not feeling quite so isolated. On-site wellness checks. So between managers who are on-site or are on-site frequently, they're doing a mix of telework and on-site. And between those employees that are on-site, making sure that we're meeting with them and making sure that we're also getting to their needs as well. We've also done multiple virtual town halls so that we're meeting our employees where they are. So we are a 24-hour operation, and we don't want our overnight shifts to feel isolated as well. So the ICS, the Incident Command team and executive team have been going and holding virtual meetings even at 9 o'clock at night, early mornings, just to make sure that we're connecting with all of our shifts and all of our employees. And really, all of this is to help with the isolation of our current work environment. And many groups of employees and departments have also been holding virtual get-togethers, virtual happy hours, of course, not during working hours, and have also held department meetings in the park, socially distanced and making sure they're wearing masks, but it gives them an opportunity to at least see each other in person and kind of connect in that way. And then lastly, what I'd like to say is, due to the fluid nature of this pandemic, we are in a constant state of continuous improvement, looking at our pandemic response, and then really making sure that we are using the lessons learned as we go through to improvise, adapt, and overcome.
Thank you, Craig. Thank you, Craig. And we have one question from Matt Som for Craig. Prior to the governor's mask mandate, did you get any pushback from staff about having to wear masks in the office? And if so, how did you deal with that?
Matt, yes, absolutely we got. And even after the mask mandate, we have continued to have, people are people, and they are all experiencing this pandemic in different ways. So we are meeting them where they're at. Prior to the mandate, it was a bit more difficult to get compliance with mask usage when they could not do the social distancing. But it really came down to having a discussion, having that one-on-one discussion so that people really understood why. If you could get them to understand the why we're asking you to wear this, that it's not, something that we're just doing to make it hard on you, but it was really more about the safety of the coworkers around you and your own health and safety and the health and safety of your family. So yes, it was trying at times, but we did get through and it did work.
Thank you, Craig. So we're going to move on to Don Elwood with the City of Minneapolis.
All right, it's great to be here. I feel like I'm at Earl Brown when I look out and I see about 81,000 people, and my panel is right here off to my side. I'm really not going to give a presentation today. I'm going to just tell a story, and through that story, you might get some ideas, right? And some of those ideas might be, oh gosh, let's not do that, or they could be ideas of, yes, but did you think of this? Or if you're my 17-year-old son, he goes, yeah, I know that already. Yeah, Dad, I know. Some of you might say, oh, I didn't know computers could do that. One of the things I hope you hear is that I've got a great team, and I think we have great access across the APWA talent. And when I look at Hennepin, I just want to point out all the people that I've come in contact on this team. When I look at just Hennepin Avenue, and you can switch that next slide to show where we're talking about, Hennepin right in downtown. From agencies, I have MnDOT federal aid, I have MnDOT state aid, Metro Transit has a big piece on this. The Minneapolis Downtown Council, the Minneapolis DID, Xcel Energy, Centerpoint Energy, they have a lot of work in this corridor. When I get to consultant teams, I got to look at the moderator. Can I say thanks to all? I can? Okay, I can say thanks to all of you. Kimberly Horn with Jonette, outstanding job on the design part. Justin Giese with SEH, great job with construction. AECom is working on this. Dan, who's on this group with WSB, working on special assessment. Marcus Thomas with Bolton and Mink. Fourth intersects with Hennepin, and that's under design. So Bolton and Mink had to be totally dialed in with what we're doing on Hennepin. Alliant, thank you. They're doing the construction on 8th. The LLRB and SRF. And there's many more people that were involved with this project. So my story starts off with, I'm in the middle of Hennepin or Nicollet Mall, and my boss asked me, hey, I want you to tear up Hennepin Avenue right through the middle of downtown. I asked. So I said, sure, why not? So off I go on the design. Next slide, please. In the summer of 2019, our design is going great. Kimberly Horn's doing a great job pulling this design together for us. Hennepin Avenue is the entertainment district of all of Minneapolis, and they say, we want a streetscape. So I'm in the summer of 2019, and I'm trying to figure out what's the streetscape going to look like. It turns out to be a $4 million streetscape spread across 10 blocks. So on a special assessment, that's $400,000 a block. I needed to find a way to tell the story. How do I show people what they're going to get for their money? So Kimberly Horn starts off with, they have these great engineering drawings to show what the lights are going to look with. Then we go to this CAD vision, and I needed to do more. And so I asked Jonette, I said, I need to do more. And oh my gosh, did they do a great job. Let's jump to that next slide. And go ahead and run the video. Really hard to put this together. Really engineering the sales department. I had to sell this product. But realize that the reality of this graphic is amazing. I don't know how they got the actual in the trees, the bike lanes, parts of the night. And so this is right before COVID. This is into COVID. It really opened my eyes that what you can do ultimately, and we can run to that next slide. During the slide, I was talking about what a great job this was for technology to help teach me what you can do before I went into COVID. Okay, so we finish up the design, and I have low technology. We go into January. I'm just continuing my story along, and we go into January. We put the project out for bids. I was just hoping I got more than one bidder, and thankfully I did. And we got the bids. We awarded the bids. It was great. Things are going great. We award the bid in late February. In March, I send everybody home, and we start construction on March 30th. And poor Justin Giese with SEH, I think he was all by himself outside. There was nobody downtown, and he was all by himself. And one of the first things I ran across was we were told to wash our hands. I didn't have any hand washing stations, and I couldn't get them. They were 6 to 8 weeks out. And so my lab group, they kind of did a MacGyver on me. They built these pictures in the left. I just said, have you ever gone camping? And boom, they got this idea, and they made this box, I don't know, $20 later. And I had a bunch of these. And then Tyzak, our contractor on Hennepin, they built that picture in the middle. That's welded steel box with hinges, and it's bolted right into the ground. So I had 2 hand washing stations on the job in about 4 days. And then I couldn't get soap. So you couldn't get it anywhere. Costco is out, and everybody's out, even Quick Trip's out. So my same group that built these hand washing stations, they said, I got you. They went to Bed Bath & Beyond. Who knew? Okay, next slide. There we go. Existing technology. So the idea is to get people working remotely and get them working fast and work effectively as a team. And my group left so fast. I think there's still food in the break room microwave. They were gone. So how do you stay close? Here's some of the things we did. Yeah, we did the electronic meetings, but right away, agency coordination, Janine called me up, and my computer started ringing, and she dialed me in on Skype. They had a problem, and we started talking about it, and we could share our screen. It was amazing. Boy, did I learn a lot that day. Use the cloud. We really started to use the cloud quite heavily. So field pictures on your phone, someone would take their phone, they'd take that picture, and it would go up to a shared drive on the OneDrive. And so then we could share those back and forth, so everyone could share it across the river or across from the office to the field. Field inspections changed. We used the cloud and the shared space to show people what are their work assignments going to be, so that survey crews, where are they supposed to report that day? Because everyone's in their own vehicles. We got out and about. The lab could have a construction project. They could take a concrete sample, bring it back to my lab, leave it outside. It would come in, and then they would post the results of the tests up on the OneDrive, up on the cloud, and then the technical team could see that. To schedule the crews, we started using the cloud as well, and those smart sheets, so the crews knew where they were supposed to go. Staff knows which jobs that are going on each day. Same technology. It's all this existing technology. Out in the field, we put our crews in separate trailers, or our own trailers. So we had a Minneapolis trailer on a job site, controlled the access to those. We have people in separate vehicles, and we would supplement them with more inspectors if needed. Microsoft Teams has really helped, just trying to get people to use Microsoft Teams. PDF files, I learned this, you can take a PDF file, convert it to an MP4, put a voiceover, and make it into a YouTube video right out of a PowerPoint. And so I learned this with Mike Marty and LRRB when I was at APWA last fall. I saw a video they put together on how to care for your sod. And I took that idea and said, well, can I do a frequently asked questions for special assessments? So we've used that. There are many of these technologies that we can use that are existing today. Then I get to some of the high-tech things. We've been using a company called Multivista. The picture on the left shows an internal scan of a historic theater on Hennepin. And the picture in the middle is when we take photos in the field, it's automatically tagged to a location, and we can put voice on top of it. We record our voice about a condition or something we're seeing. That's all stored in a database. So now I can go back and look right on this app. It's very simple to use, and see real-time pictures. I can even take measurements on the photos because the photo is overlaid on top of the scans. The emerging technology then also goes into drones. And if we can go to that next slide, SEH pulled together a drone on how to communicate to the public of where we're at, because they're all at home. No one's coming downtown and they got to see what's happening on Hennepin. Please start that. And then the last slide. I want to wrap up with two things. One is I can't wait to get back to the office and get back to the way that things were. Look, in March when we left, I don't think we are going to go back to what we were in March. Just as strange as this photo looks, things are going to change and we aren't going back in a number of places. We're going to stay the same way we are. And I want to end by, again, thanking the team that has pulled this together. There are so many great consultants that I have access to help me with Hennepin, and they're doing an outstanding job, from videos to technology to helping me try to deliver a major project in downtown Minneapolis. And I think it's very good. You can use that no matter where you are. I think sometimes the drone is better in rural Minnesota than maybe downtown. So thanks to my whole team. I really appreciate it. Thanks, Janine.
Thank you, Don, and thanks for being here today. And we appreciate the stories and the challenges that you've shared with us regarding the construction work in downtown Minneapolis during this time. And I think, Pat, we're going to go ahead and move on to Dan and Dan.
Yeah, thanks, Janine. I'm Dan McNeil with SRF Consultant Public Engagement Coordinator. Very happy to be here today with the APWA membership. Myself and Dan Pfeiffer are going to talk a little bit about the public engagement work that we've been doing since the COVID pandemic has started. As you've heard today, there's really a need to be adaptable and creative in finding the right solutions to our projects during these times. Since mid-March, engagement has really needed to pivot and change our approaches. All of a sudden, all of these in-person events that we had been planning for the upcoming summer and spring need to go online or need to find new ways to reach our audiences. So today, Dan and I just want to highlight some of the pivots that we've made and the lessons that we've learned, really to continue to put the user experience first and foremost in our work. So with that, I'll ask for next slide.
Yeah, so one of the significant challenges we faced as we moved into the COVID-19 pandemic and having to shift to a distance engagement methods is that we're not able to meet in person. Next slide, please. So our engagement toolbox is filled with many options for distance engagement, from the low-tech mass mailings, telephone town halls, voicemail boxes, to high-tech synchronous or asynchronous virtual meetings, webinars, and websites that have activities to gather the community's lived experiences. Next slide, please.
Yeah, and as Dan mentioned, there's a lot of synchronous and asynchronous tools. And so for those synchronous tools, we're talking about opportunities where the project and the community are interacting in real time. Like we would do at an open house, a focus group meeting. So how do, we really had to think and strategize how we're going to turn that into a virtual format. And a lot of what we've been doing since March has been taking place online. So we've hosted a variety of live virtual meetings where, very much a Zoom platform similar to this today, where a panel is presenting a PowerPoint presentation, sharing information and videos. And then we're facilitating a live Q&A session with the public. So that's worked really well for pivoting our open houses and also for our focus group meetings. We've also developed some online open house websites, right? So that's more of that asynchronous where folks can come and visit at their leisure. We're combining a few different mediums, right? Videos, surveys, wiki maps, project information to really make sure that folks can get the information they need at their comfort level on their time. And that, developing those tools has brought some key considerations to the forefront. Getting the word out is key. So understanding your audience and making sure that they know how to access that information, and we're reaching them in a way that's meaningful. We'll also highlight today some of the ADA and accessibility considerations that are really key to developing virtual tools. So just wanted to highlight some of the tools we're using, and now we'll kind of keep talking through how to meet that user experience. Next slide.
Yeah, so access to broadband. So as we look at shifting to those high-tech, virtual environments, we need to consider access to broadband as a key component in that tool selection. And that access to broadband can both be geographically located. So if you haven't seen, MND has a Office of Broadband. They have a nice GIS map where they are tracking broadband development. This is especially important as you move away from the metro area. From a demographic data, we can understand internet usage and access of the populations in a community. We know that certain demographics are less likely to have home-based internet or to access the internet solely on a mobile device. And so we need to target our methods that way. Recently, we were doing a project in northern Minnesota in Oakley, which it's an underserved community for rural broadband. And so we instead created a magazine type mailer that had the 3 design alternatives and a survey with a return envelope, and we mailed it to every household. And so we received 21% of the households filled out the survey and returned it. Next slide, please.
Right. So that really is a key consideration of understanding how we're going to get the tools that we develop out to the public. And, for how much everything has changed during COVID in terms of the tools we use for engagement, a lot of our promotional strategies have remained the same and have become more important than ever. So similar to Dan's example, making sure that we're using mailers to send that direct mailing out to folks, to link them to an online opportunity, or to request a mailed version of some information is an option. Similarly, those press releases and local media outlets have been really critical to communicating, the key message and to get that word out. Social media has become more important and more helpful than ever for this process as well. So we've really done a lot to develop some visually appealing promotional tools, but then also have the opportunity to do Facebook Live. So there's some connection to streaming that and joining the conversation right through your social media platform. Targeted advertising has also been a really helpful way to hone in on an audience you're looking to reach and make sure that you have a low cost, easy to access option to reach that audience. You know, and as I mentioned earlier, a lot of our synchronous tools for hosting meetings, we've also developed some hybrid approaches where when it's appropriate, there's a small group in person and the ability to join that meeting virtually for those that are more comfortable or you know, just from their own standpoint have to join virtually. So I see that as an opportunity and something that we'll be able to carry forward well after the pandemic has come and gone. I think a lot of the work and the effort that has gone into developing online tools is something that will really benefit public engagement in the long run. Also wanted to just touch on that for those synchronous tools, the roles that we've developed for meetings has been a really key consideration. So there's a facilitator, there's an IT behind the scenes tech support, and there's a moderator or a welcoming face, and breaking out the roles and helping meetings to move along that way has been a key consideration as well. With that, I'll pass on to the next slide.
So for another one of our projects in the East Metro, we were in process of planning a in-person public meeting right as the COVID pandemic took off in the spring and the stay-at-home order was issued. And so with good internet access, we were able to shift to a asynchronous website. So it had a welcome video, provided an overview of the project. There was a comment map. There was also surveys. And so we did 2 rounds of this in May and July, and we primarily targeted our invitations through known stakeholder groups and through boosted social media. And through that process, we had over 3,500 site visits to the website. 550 surveys were completed and 70 plus comments and discussion comments on the map. The social media exposure was about 60,000 users, and they were targeted in that geographic location. And then for the version for the time period in July, we did send a postcard to all the residents within the surrounding area of the interchange. Next slide, please.
So as you can see from Dan's example there is a lot of great connections happening. I mean, we're really seeing a lot of people participating in these online tools. And I think that part of that is the extended comment periods that, you know, instead of needing to be at a meeting from 5 to 7, the opportunity to jump in and share your thoughts over a 2-week period with the ability to kind of ramp up what we're sharing online and how people can view that information, which is really exciting. I think that has been a really positive revelation as we've gone through this transition, to see how many people are joining either a live meeting online or finding their way to a website. You know, that's not to say that there needs to be that important consideration like we've talked about to, you know, take things that make sure that there's access and the ability to reach those audiences that might not have broadband or that are underrepresented. So one really important best practice that existed in our field well before COVID, but has become a major consideration and priority is web accessibility for anything that we're developing. Really want to highlight the importance of the web accessibility guidelines. It's 2.0 now. This is a kind of a major document for ensuring that anything you develop and put up online can be perceived by any audience that might need to access it. This is talking about things like color contrast. So making sure that you have light and dark offsetting colors so it's easy to read and see. Making sure that any visuals that you show have alternative text involved so that a screen reader can easily translate that information. So just wanted to really wrap this up by highlighting the importance of that consideration and like the mobilization that has happened in our field to put this first and foremost in the start of our projects as we develop our materials, understanding how accessibility, perceivability, and operations are going to meet the user experience wherever they are. So just wanted to highlight the importance of web accessibility guidelines. And with that, we'll say thank you.
Thank you, Dan and Dan. I appreciate your time today. And I wanted to ask the two of you a question. I just participated in an open house on one of our projects in a community. And one of the concerns, we had a lot of people at the virtual open house, but one of the concerns that I had is for the members of our more senior members of the community that aren't as familiar with technology. How did the two of you overcome that?
So one of the key considerations is to start with an overview of how to use the technology. So a lot of the online tools, we like to have that pop up or that initial, here's how to use this site, here's how to use the meeting, here's how we're going to run the meeting. For some members, it's important to use a virtual platform that allows a call-in function. So like Zoom, you can call in. The same raise your hand function that exists on the computer version exists on the telephone version. So going through in the beginning and providing that instruction that when we get to the Q&A time, if you'd like to speak, push, and I believe on Zoom it is 9. It's either 6 or 9. You push it, it raises your hand. I always have to look it up right before I put it on a slide.
Thank you, Dan.
Exactly right. And I might just even add, I think that phone has been a big piece for those audiences in particular, and holding virtual office hours where you can just have a 10-minute conversation, but using traditional media to promote it and then offering that phone connection that folks are familiar with has been very helpful.
Thank you. And then we have one more question. It's for Don Elwood. Don, given the fact that oftentimes the public perceives the construction workers as agents of the city, and people are very concerned about COVID, what measures has the city of Minneapolis taken to encourage construction workers to follow the CDC guidance? Excuse me.
Good question. I've asked my staff, do that social distancing, go out to job sites in separate vehicles. Some work just doesn't lend itself to distancing. You have to have crews in close proximity. And I think each contractor has a different COVID plan depending on the job. Bridge job is different than a roadway job. And sometimes they'll isolate, like a concrete crew is different than an excavation crew, which is different than a water crew as an example. And so that's how we've handled it. And each job, they do a very good job. Each contractor's done an outstanding job. So things are going really well for us.
Thank you. And then our last question for the day is for Brian Funk. Brian, the pandemic has amplified the homeless situation in the Twin Cities this past year. Recognizing that transit has been a refuge for some folks, what is Metro Transit doing and anticipating, and how are you preparing for any sort of surge in these types of riders as we head into the
Yep, it's an excellent question, and it's something that we've been preparing for actually for years, even before the pandemic came to light. And so we do have a couple of big key strategies. One is our own homeless action team. Those are specially trained officers within our transit police department who are skilled at making those community connections and viewing this crisis as something that can be problem solved and not treated just through traditional law enforcement means. And so getting people connected with either temporary housing or services that may be needed can really be a helpful solution. We've had a lot of success, and that team has been recognized widely for groundbreaking efforts. In addition, we've been partnering within the council with our housing unit to try to identify vouchers situations to be able to relocate and rehome families. The update I had at the beginning of this week, closing out because I know we're kind of coming up on time, is that I do know that right now shelter capacity is in a pretty good spot, actually, given all of the things that have happened and all of the news media coverage about people staying in parks and at different hotels. And so there is capacity right now at a lot of the established shelters, but it doesn't mean it's going to stay that way. And so we're going to continue to work on solutions, recognizing that we end up being one of the last places or a landing spot for people who've exhausted other options. And we want to continue to focus on our mission and purpose, which is a transit agency, and getting folks the help they need so that they can have that dignity to be able to, sleep safe and tight like all of us want to each night.
Thank you. Thank you very much, Brian. And so I'd like to thank the panelists on behalf of the chapter, Brian Funk, Craig Edlin, Don Elwood, Dan McNeil, and Dan Pfeiffer. You all did a really, really nice job. Very much appreciate it. Just want to mention this presentation will be on the chapter's website. And then I'd also like to ask that you look for an email regarding another virtual session that is being planned by our conference planning committee on racial equity. And so on behalf of the chapter, I wish you all the best. Take care. Please stay well and hope you enjoy the upcoming Thanksgiving holiday. Bye, everybody.